we also need clean gloves. Because this is a clean glove. I'll replace your gloves. Since I don't have them. Okay, so this is a clean procedure, and you need all kinds of tools for this. You need a stethoscope. You need some cloth tape. You need your piston syringe or a 60cc syringe. Pen light, the tube that the doctor has ordered, an emesis basin, and we need lubricant as well. We don't have lubricant in there, but we'll just simulate. Does anybody have like a little piece of paper that you can just cut so we can simulate that is my lubricant? Okay. Improvising, yes, just for a piece of paper or cardboard. There you go. Okay, this will be my lubricant and my pH paper. Okay? So you notice you need a lot of stuff. You need to put it together because it's not a kit like your other ones. So always explain procedure to your patient. Ms. Jones, we are going to put in an NG tube today because the doctor wants to get some of the air out from your stomach, okay? It's for decompression, so it could be, most of the time it's a lot of air or maybe bleeding that's going on. Ms. Jones, this is a very simple procedure, and it's not a painful procedure, and this is what the tube looks like, okay? I'm going to let you touch it so that you can see that this is very pliable, it's very movable, so you allow them to do this. Can I get a cup from back there too? If your patient is not NPO, you can get some little ice chips that will help assist in swallowing. So I'm just going to simulate my patient is not NPO, and it's okay to give her ice chips. So Ms. Jones, I'm going to just give you this cup with ice chips because I'm going to need you to help me swallow this tube later, okay? And then as I am putting this tube through your nose, I'm going to ask you to swallow. And when I tell you to swallow, you can take a little ice chip and then swallow, 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 all right? But before I get started, I am going to do I'm going to check one thing here. For this flashlight, I'm going to check your nares, that's the little holes in here, to help me see which of these is the best one for me to do that. If you had a tongue depressor, you would also assess the pharynx. Assess the pharynx and everything is clear, nothing to be concerned about way back there because the tube can irritate. So now you have, she is good to go. The next thing we advise you is to take a little piece of tissue and have the patient blow their nose and blow air from one nary, blow air from the other nary. I am going to establish that this left nary is the best candidate. Always bring stuff close to you, so you don't have to go around. Emesis basin, because often the patients become nauseous and they may have a need to throw up. But we're also going to use it to put our lubricant here. So Ms. Jones, if you at any time feel like you're nauseous, please go ahead and use this, okay? Or let me know, or I will help you with that. So leave that there for your patient. You're going to need a 60cc syringe. This is actually a whole kit that is used for feedings, but this is your 30s. Yeah, this is a 60. Okay, make sure it works. This actually comes with a little towel. Or you can just get a regular towel or chucks and put it over the patient's chest. You want to protect them because, again, they can become nauseous and you don't want to soil their clothing. Now that that's there, the next thing is we are going to measure, like your video calls it, right? Nose, ear. So from the nose, tip of the nose to the ear, tip of the earlobe, and then to the xiphoid process. Okay? Mark it. A Sharpie comes in handy. But if you don't have a Sharpie, just take a little piece of tape. Okay, so now that's there. I also, ahead of time, I want to cut my tape. I'm going to need 2 pieces of tape. This I should have done without my gloves because it's a lot easier to manage. Clean with alcohol. Put it there. And then the second one. Like that. Okay? All right, now I'm set. Lubricate this really, really well. Preferably about that much. I don't know if you noticed that ahead of time I was doing this. Okay? That is to help guide, make my tube a little more curved in the direction that it's going. You see that? So you want to go ahead and lube it after that. Ask your patient to put the head. Where does the chin go?
Down.
Okay, so Ms. Joan, would you please put your chin as far as you can on the chest? All right, we're going to start this process, and it's going to be quick, all right? So, there you go. All right. It looks like I probably reached my pharynx. Okay, Ms. Jones, can you take a little piece of ice chip? And you go as fast as you can. Keeping an eye on your patient. Good, you're doing very well. My tube doesn't go any farther in the mannequin, but let's say it did. Actually, it will go. Okay, I reached my destination. Okay, right there. You can leave that little piece of tape there, or you can remove it. Okay, now you're going to put this guy, the one that is split, right there, and you're going to take these little sides and just wrap it around, like so. Like so. Okay. You did very well. We won't even need that anymore. Next thing is you're going to auscultate. Put 30 cc's of air. Get your syringe. 30 cc's of air. You're going to use this side right here. Okay. This it's like a little lock. It helps to join these two. You'll see in a little bit. But for now, just put it there. Get your stethoscope, put it on, put it over the epigastric region, and just quickly let your air go. And you should be able to hear of air. There's a really good indication that the tube is most likely in there. Now, depending on the policies of your facility, they may want you to send the patient for x-ray, or they may just want you to do a 10 ml, check the pH. You see this? It plugs. All right. Check. We do want you to know the pH, okay, for the stomach, the lungs, and the intestines. So if that confirms to be okay, get a second nurse to kind of listen again, just to make sure. Some nurses, you're going to find that they will do this. That's because they're listening for air. Because if this is in the lungs, you can hear the patient breathing in and out through there. Okay? You're going to find that other nurses will put it in water. Because if it's bubbles, it means it's in the lungs. So I'm telling you these things so that, if you see both, you kind of know what's going on. All right. So what do I do with the remainings of this 10 cc's if I use it? Put them back, right? Because I don't want to mess up the electrolyte balance that this patient has. It's for decompression. So now the next thing is for me to just plug this, secure this to the gown, preferably with a piece of a tape attached to here, and then a pin, a safety pin there. But we don't have a safety pin, so we don't want this just moving around. Okay? Leave them enough room so that the head can turn without pulling. If you're not sure that that's going to stay, just put an additional. Now, some facilities have something called tincture of benzoate. Tincture of benzoate. And first we clean the nose with alcohol, and then we put the tincture, which helps it stick really, really good. Other facilities have special Band-Aids just for this. So this is just in case, you know, and you see this is not going anywhere. It's well secured. Can you pass me the decompression over there? There should be a tube, and it has a tip to it. Follow that long, long tube.
When you put the gastric juices back in the tube, how does it make its way into
You
the
have to
tube?
flush it again?
You have to flush it?
It depends. You will have orders of how much to flush. Okay? If it doesn't, you don't have any orders, sometimes we just push enough air so that the gastric juices go through the nose. Once you don't see them here anymore.
The air is not irritating the
No,
Okay.
because that's just gonna come right back up. You don't wanna put too much, because you already put 30 cc's in there. All right, so now you connect it to suction, if that's what the order says, or you connect it to the feed, okay? And this just stays open, like so. Got it? That's all there is. You assessed already, I forgot to mention, make sure that you assess the bowel sounds before you start this procedure. And clean your stuff, you wash your hands, keep the patient comfortable. You're gonna chart the type of tube, the size of the tube, any amount of gastric contents that you have, the pH if you did a pH, and patient tolerance, and that's if you connected it to suction or if you connected it to feeding. If it was to feeding, what type of feeding and how much, at what rate. That's it, guys.